Hello, I'm Dr Saqib Chowdhary. I have been a consultant cardiologist working at Wythenshawe and here at the Alexandra Hospital for 13 years, and I sub-specialise in interventional cardiology and TAVI. Now, as an interventional cardiologist, I am asked to see a lot of patients with chest pain, and there are many causes of pain in the chest. Not all of them are connected to the heart, but certainly pain from the heart, angina, is the most concerning, and many patients are very understandably worried that it may be the harbinger of a heart attack. Now, angina is actually a symptom, not a condition, and the disease is actually known as coronary heart disease. So, how would you know if you might have angina? This can be very difficult because the symptoms of angina are very varied from person to person. And ultimately, the short answer to the question is, if you are concerned, you need to speak to your GP. He may do a resting heart tracing or ECG on you, but that will only determine if you have pre-existing significant heart damage. Ultimately, to rule out or confirm a diagnosis of angina, you are going to need to be referred to a cardiac unit or a cardiac specialist. The typical descriptions of angina are generally a heavy pressure in the center of the chest, or sometimes a constricting band right around the ribs. Frequently, it will radiate up into the neck and the jaw, sometimes in the arms, predominantly the left arm. However, I've had many patients where the principal pain is in the right arm, where it's in their back, even patients who've had the worst pain radiating up into their teeth. So it depends on how you are wired, and everybody is wired differently. So there is no one description of what angina is and is not. In some patients, for example, there is no discomfort symptoms at all. It's merely shortness of breath on exercise. As you can see, the assessment of symptoms that might be angina can be very complex. If you think that you have any of the situations that I've discussed, then please do arrange to see your GP promptly and discuss how it might be investigated. You could also come here to the Alex to see an interventional cardiologist such as myself. Now, one very important thing to say is that this is only in the context that your symptoms are short-lived, that they are getting better when you rest or stop your exertion, and they are not occurring multiple times per day. If your pain is severe, or even if it's more manageable, but it's going on for a prolonged period of time, more than 20 minutes, especially if this is new for you, then you do not have time to seek an opinion from your GP or another specialist. You need to call 999 straight away and get taken to an A&E and get checked out.